All right, Mr. Sallard, we appreciate you for coming back today. We're just going to go over some of the results from your fitness assessment that we did. So we came in at a BMI of 27.5. That's actually going to classify you as overweight. And then whenever we looked at your resting measurements, we had your resting heart rate as 76 beats per minute. This actually puts you in the normal and healthy range. We usually tend to look at anything below 60 or above 100 as being out of normal, so you're right there in the middle. Your resting blood pressure came in at 132/84. That actually is going to come in at pre-hypertensive in the pre-hypertension classification. Anything above about a 120/80, we're going to classify as pre-hypertensive, so that could come down a little bit. Looking at your body composition for waist to hip ratio, your waist circumference 38 and your hip circumference to 42 inches, that's going to give you a ratio of a 0.9, which is actually going to put you in the high classification. We tend to like to see that a little bit lower. Higher. Anything above a 1 usually is going to be out of the high classification. Over to your skin fold, your 7-site skin fold came in at a 132, and your 3-site skin fold came in at a 66. We use those to calculate your body fat percentage. So that brings you to a body density of 1.06, and then whenever we put that in our calculator, that's going to come out to a 16.9% body fat. For your age range of 29, you're 29, so an age range of 26 to 30, that's going to come in at an average classification, which is really good. Looking at your 3-site skin fold, that's going to come out at a body density of 1.05, which puts you at a 21.4% body fat. For your age range, again, that is also an average classification. So we're good there. There's room for improvement, but it's not bad. For your cardiovascular assessment, we did the cycle test. You have an age predicted heart rate of a 191. That is dependent upon your age, which puts you at 85% of a max percent. 85% of your age predicted max heart rate of 162. So whenever we did your test, you never actually reached that 162, which is where we would terminate it. You did reach 160, which got close, but we didn't have to terminate it there. But it looks like we did reach a RPE of 18, which is why we had to terminate the test at that time. Anything 18 up was where we would cancel that. So whenever we take your results from the cycle test, we actually put it in our VO2 max calculator, and that brings us to a VO2 max of 27.5. That classification is actually going to be very poor, so there's a whole lot of room for improvement there, but that is something that we can work on. Moving on to our muscular endurance, we did the max push-up test, which you did 45 reps, which will actually put you in the excellent category, which is very good. And then we had our partial curl-up test, which got a 50 rep final on, which also puts you in the excellent category. So we're doing really good in the muscular endurance category. Moving on to flexibility, we did the back scratch test where you came in on the right and left side of both at positive 1 inches, which is really good and puts you at the above average classification. And then we did our standard sit and reach where you came in at 15 centimeters, which is about average. We have the good classification here, which is about the 50th percentile. So you're actually like right there in the middle as far as flexibility. And then we're just going to kind of read over this. This is your interpretation and goals based off of all of your results. So I'm just going to read this over for you. It says your body fat content is 16.9%, which considering your age and weight, this puts you in the average category. However, with the BMI of 27.5, putting you in the overweight category, weight loss is recommended. We're going to try to bring that BMI down. On average, males of your age have a BMI of 18.5 to 24.9, so you can see where there's a little bit of room there to bring that down. To form this weight loss, try to participate in normal aerobic exercise and eat foods that are low in fats. In relation to this, your VO2 max test came in at 27. This puts you in a very poor category, so that really needs improvement. So back to that aerobic exercise, we need to improve that by doing some brisk walking, running, cycling, swimming. Anything to get that heart rate up. These should be done at least 3 to 5 days a week and for 30 to 60 minutes a day. You should push yourself in these exercises, but monitor your heart rate, like I said. And back to the age predicted max heart rate, we don't want to go over 162, so be sure not to exceed that. Your muscular endurance test containing push-ups and curl-ups both show you in the excellent category, which is really good. These monitor the endurance of your upper and lower body. It is important to keep these in the excellent category because if you have fatigue, in your muscles that can lead to injuries. To help maintain your level of endurance for your muscles, exercise at least 2 to 3 days a week. Any exercise that includes pushing, pulling, or flexing of the muscles to help you keep that muscular endurance that you already have that we saw in those tests. For your flexibility, these contain your back scratch and your sit and reach test. These evaluate the upper and lower body of your flexibility and your range of movement. Your back scratch test puts you in the above average, which is really good. And your lower body sit and reach test came in the good category, around the 50th percentile, like I said. So these are, those are good. There is room for improvement as always, but it is good to keep these up because those are for your posture, your range of movement. So it's good to work on these to at least 4 to 7 days a week. Involve stretches that stretch your muscles and ligaments of the shoulder, hips, back, and legs, which are really important for just about everything in daily life. So these stretches you should do for at least 30 seconds each, and you should probably do 3 to 5 repetitions of each one when doing those. First thing we discussed was your resting heart rate. You came in at 76 beats per minute, which is considered normal. That's really good. That heart rate is a reflection of your overall health. If you have anything below a 60 or above 100, these can be indicators of a health issue. So it's important to keep that where it's at. Just keep working on that. That can improve as well when you do those exercises every week. Your resting blood pressure came in at 132/82. Those are two numbers that are we call our systolic and diastolic. Your systolic is going to be that higher number, and your diastolic is going to be that lower number. These are also great indicators for health issues and heart attacks because they involve your heart. So with that 132/82, that's going to come in at pre-hypertensive. Like I said, anything over 120/80. So there is room to bring that down. Participating in those exercises, like I said, are going to be a great improvement for those measurements and lower your risk for heart disease and other health-related issues. But that is all I have for you. I'll give this to you for you to keep, to look over, and to do those exercises. And we appreciate you coming in, Mr. Sallard, and hope to see you again.
Thank you.